5 questions with Dr. Victor Coelho, consultant urologist on kidney stones. What are the main causes of kidney stone formation?
So kidney stones can actually be thought of crystals that are forming in concentrated urine. So one of the most important cause of kidney stone formation is inadequate hydration or consuming less amount of water. Other causes could be increased intake of dietary salt, either in the form of plain table salt or foods containing high amount of salt content. There are a number of other causes which could be any medical conditions and also certain genetic factors which a very few patients could present with.
Doctor, what are the symptoms the patient will experience?
One of the most common symptoms with the patient presents to us is pain. The pain initially starts in the region of the loin or the flanks and then migrates to the front. So what is classically described as something as loin to groin pain. The patient may also have complaints of passing blood in urine, which is hematuria, some amount of burning while passing urine, which is dysuria. If these symptoms present along with fever, that is a red flag symptom and the patient should seek immediate care under the care of a urologist.
How do you evaluate such patients?
The evaluation of such group of patients initially begins with the patient's own symptoms. Once the patient presents with certain symptoms, we have to do a series of blood and urine investigations where we are looking for presence of blood in the urine, presence of infection in the urine and imaging. Although ultrasonography can be used as an initial screening tool, a non-contrast CT scan is the most ideal imaging modality that can be used for evaluating patients with stones. Now why CT? CT gives us information regarding the size of the stone, the hardness of the stone and also gives us an idea how to plan for the treatment.
What treatment options are available?
The treatment option for stones in the kidney or the bladder or the ureter depend on a number of factors. It depends upon the size, it depends upon the hardness of the stone. If the stones are more than 2 centimeters located in the kidney, we would advocate PCNL, which is a hole that is made into the kidney and the stone is extracted. For smaller stones, nowadays we do something called the RIRS procedure, which is using a flexible scope to go up to the kidney and fragment the stones. Other modalities of treatment include lithotripsy, which can also be provided to the patients.
How can one prevent stone formation?
Stone prevention involves a number of factors, but the most important factor in preventing stone formation is adequate amount of hydration. Adequate amount of hydration would mean that a patient should be able to pass clear white urine. So on an average, if a patient doesn't have any kidney problem, doesn't have any cardiac problems, we recommend between 2.5 to 3 liters of water consumption daily. Also, we have to reduce the content of salt in the diet. A well-balanced diet and a diet which is rich in fruits and vegetables is an ideal way to prevent recurrence of stone formation. Thank you.
You like these 5 questions with our expert and have got something on your mind? Drop it in the comments or DM us at 9850 643581. Your questions could be featured in our next video.